True/false, patients who suffer from paraphilic illnesses, which include aberrant sexual behavior and sexual dysfunction, experience personal pain over their interest. A. False. B. True. What differences do sex and gender have? A. Sex is about procreation. Gender is about who a person is attracted to. B. Sex is about who a person is attracted to. Gender is a means of classifying people based on sexual organs. C. Sex is a means of classifying people based on sexual organs. Gender is a psychological state. The group discusses its successes and feelings around the group's dissolution. A. Group polarization. B. Social justice. C. Static risk factors. D. End stage of group. You query Alice, your client, what do you think your coworkers would say if a future employer asked them what they think about you? You are evaluating A. Dependency. B. Reality testing. C. Self-concept. Which one of these actions is not essential to good group leadership? A. Unconditional positive regard for and non-judgmental acceptance of group members. B. Recruiting members to ensure a large and diverse population, ideally consisting of more than 20 group members. Joseph and Helen are meeting for their regular session. What would your life be like if you could cure the largest problem in it? Helen wonders. This is an illustration of A. Staging question. B. Deficit question. C. Miracle question. Your female client has undoubtedly suffered from partner abuse. She finds it difficult to discuss what happened. Which of the following should you choose to do? A. Tell her disclosing all of the details will help her heal quicker. B. Asking how you can help while emphasizing that she does not need to disclose everything right now. A social worker is piecing together the client's presenting behaviors during an interview with a client to develop a fresh picture of the challenges the client is facing. What method of interviewing is the social worker employing? A. Interpretation. B. Reframing and relabeling. C. Universalization. Examines the generalizability of those conclusions to the general population. A. Construct validity. B. Ecological validity. C. External validity. D. Latent content. Subjective, a client's account of how they've been doing since their last visit and or the circumstances that led them to seek treatment. A. False. B. True. A recent client self-reports to you that she has been using cocaine frequently for a number of years. What should you do first, exactly? A. Diagnose her. B. Recommend inpatient treatment. C. Gather as much information from her as you can. Which one of the following laws was established first? A. The Child Abuse and Prevention Act. B. Civil Rights Act. C. The Family Medical Leave Act. D. Affordable Care Act. When someone is told repeatedly that everything will be okay, you can anticipate the following response. A. Have great confidence in your ability to help. B. Doubt the person's ability to help and understand their problem. C. Be cautiously optimistic. When does everyday anxiety transform into a significant issue, triggered by life challenges like impending divorce, job loss, or a child's academic struggles? A. When it alerts one to a problem. B. When it interferes with problem solving. C. When thoughts turn to self-harm. The therapeutic intervention that would be least helpful to use with an older client is A. Using multidisciplinary teams. B. Using supportive therapy. C. Using a non-directive therapy modality in which the client sets the pace. As a social worker at the community center, Ron and James, a couple facing addiction issues, seek your guidance after their tumultuous breakup. How can they navigate the situation and avoid further complications? A. Broker. B. Mediator. Clients might employ a variety of self-defense techniques to keep themselves safe during therapy sessions. Which of the following best characterizes the substitution defense mechanism? A. Replacing an unattainable goal with an attainable goal. B. Justifying an unacceptable action in order to make it acceptable. Which of the following best encapsulates the NASA's recommendations for using self-disclosure? A. It is only used with informed consent. B. It is up to the social worker's discretion. C. It is only used as a last resort. D. It must be approved by a supervisory authority. An example of a situation in which family counseling is not advised is as follows. A. When boundaries are violated between family members. B. When the family members are resistant, unmotivated. C. When deceit is apparent between family members. D. None of the above. In your role at a women's shelter, Timmy, a recent victim of sexual assault and displacement, shows signs of trust and occasional smiles. What steps should you take next to help her overcome the crisis? A. Identify the major problems. B. Implement an action plan. C. Generate alternatives and coping strategies. A therapist is meeting with a client for an initial evaluation. The client reports feeling moody and has been having many headaches. The client states that she lost a lot of weight recently and has noticed a decrease in appetite. The clinician should first A. Assess the client for suicidality. B. Refer the client to a MD. In a 10-week group for men with AIDS, a member feels frustrated and disconnected after the third session. Unsure about continuing, what should the social worker do first? A. Schedule a private session to address the member's frustration and disconnection. B. Encourage the group member to bring this up in the next group session. Studies that collect and analyze data from the whole study population at one point in time is called A. Single subject design. B. Cross-sectional studies. C. Retrospective study. D. Case study. The father, responding to increased gun violence, organizes a neighborhood meeting to discuss its impact and explore collaborative solutions. This is an example of A. Advocacy. B. Community organizing. The social worker is creating a job assistance program for youth leaving the juvenile justice system, having conducted a needs assessment and set program goals. What should be the next step? A. Create an action plan along with a timeline for implementation. B. Create a planning team which includes identifying key staff. For a 15-year-old client referred for an initial assessment due to school violence following parents' divorce, the therapist's first priority to build the therapeutic relationship is A. Go over the limitations of confidentiality with the client. B. Complete a biopsychosocial assessment. The therapist, facing a court order to release a client's records in a custody dispute, advocates for limited disclosure to protect the client. The judge denies the request. What should the therapist do next? A. Release the records to the court immediately. B. Speak with a lawyer. In an assessment, a client reports low mood, sleep issues, and concentration problems persisting for 3 years. Despite a past sexual assault 7 years ago, the client claims not to think about it. What is the client's most likely diagnosis? A. Major depressive disorder. B. Persistent depressive disorder. A therapist is developing a website to promote her private practice. It would be unethical to do which of the following? A. Highlight the therapist's expertise. B. Share extensive information about the therapist's training and background. C. Collect clients' testimonials highlighting the effectiveness of treatment. During a home visit for a family that recently lost their mother, the father displays aggressive behavior towards a child. What should be the social worker's first response? A. Call the police. B. Make a CPS report. Given Scott's dissatisfaction with traditional therapy focusing on issues rather than solutions, what goal would a clinical social worker prioritize to empower him towards positive change? A. Solution building. B. Positive attitude. In a case involving child sexual abuse, an adult daughter shares her own abuse history, leading to the perpetrator's extended jail sentence. Why is this disclosure not considered a breach of confidentiality in clinical social work? A. The perpetrator had no rights while in jail. B. It involved child abuse. Clinical social workers often find themselves in dual relationships. The management of transference and countertransference cannot be ignored. Within the realm of child welfare, administrators play a vital role in what areas? A. Modeling, coaching, and engaging. B. Knowledge and training. C. Education and management. In a multidisciplinary team aiding individuals with disabilities, including doctors, therapists, and social workers, which area would a professional social worker typically avoid engaging in? A. Locating respite and family support. B. Diagnosing the disability. What approach involves continuous collaboration among professionals from different disciplines, working towards a common goal? In contrast to the limited accountability of the traditional multidisciplinary approach? A. Individualism. B. Interdisciplinary. What role does a clinical social worker play when identifying knowledge gaps, collaborating with advocates, acquiring information, and conveying it empathetically to the client? A. Supervisor. B. Educator. Clinical social workers need to obtain informed consent prior to services provided by telephone, computer, radio, or television. Client approval is also necessary prior to A. Third-party observations. B. Audio taping. C. All of the above. In the context of the aging process and human behavior in the social environment, what factors affect the level of interaction an elderly person has with others amid losses like driving, eating, or bathing independently? A. Health and mobility. B. Friends of the same age. When parents seek help with child discipline, a medical model focuses on fixing symptoms, while social workers employ a holistic approach known as A. Person in environment. B. Behavior therapy. To address Lisa's chronic school absenteeism and fatigue, what type of problem-solving should a clinical social worker initiate after conducting a thorough assessment and formulating a treatment plan? A. Collaborative. B. Independent. In determining if a situation is a crisis, which criteria are used, considering that crisis is a common aspect of life where individuals utilize coping mechanisms, and typical techniques may fail in the face of threatening problems, leading to feelings of guilt, anxiety, helplessness, and fear? A. An individual's view and response to an event. B. How others view and respond to an event. According to research on autism, individuals suffering from this disorder have abnormalities in several brain areas. Manifestations vary according to chronological age and developmental level. 1/3 of people with autism have A. Appropriate peer relations. B. Normal IQs. Task-centered therapy, emphasizing individuals' inherent resources and problem-solving capacity, collaboratively defines and resolves issues within family and environmental systems. In short-term treatment, the focus is on what? A. The environment milieu. B. Specific interventions to resolve problems. The Parson family, due to strong religious beliefs, refuses medical care for their son, even though it's essential for preventing death. Is this decision against the law? A. No, the judicial system is required to respect religious beliefs. B. It varies by state. Cynthia is an infant who lives with her teenage parents and her parents' friends. There has been very little bonding between parents and child since birth. Which of the following is likely demonstrated by the infant? A. Mistrust of the environment. B. Lack of social responsiveness. Sandra, a single mother of two, has low expectations for her daughters, avoids confrontation, and prioritizes keeping peace in the home. What parenting style is she demonstrating? A. Authoritarian parenting. B. Permissive parenting. Clinical social workers employ two types of family-centered services. The first supports families in managing everyday parenting stress to prevent child maltreatment. The second, designed for those at serious risk or in crisis, is commonly known as A. Family crisis intervention. B. Family preservation.